Hello, my name is Seth Morales, and I will be analyzing a case that involves improving child health through a medical-legal partnership. For step number 1, I will provide some background information about the case. Barry Zuckerman and Ellen Lawton formed the Medical-Legal Partnership for Children, or the MLPC, in Boston, Massachusetts, which became one of the most influential partnerships in the United States. This partnership allowed public health lawyers to work with physicians to prevent health issues caused by poor social conditions and to minimize the effect those conditions have on the health of the children. The two goals that Zuckerman and Lawton want to achieve through this partnership are 1. Improve community health, one family at a time, through efficient use of law, and 2. Align individual representation with broader legislative and systemic advocacy when many families have the same problems. Step 2. Identifying and analyzing the current situation. The main issues that need to be addressed are the legal and social conditions that negatively impact children's health. A strength is the formation of the MLPC has already identified various conditions, and some of these conditions include financial issues, housing problems, and the list goes on. A weakness is that when it comes to health, the focus has been on health insurance and payment rates rather than overcoming these social and legal barriers. An opportunity is the MLPC can provide healthcare training, health education programs, legal services, and other healthcare services with the goal to overcome these barriers. A threat are the uncontrollable factors that lead to these issues and actually getting families to take advantage of the services offered. Step 3. Prioritizing core issues. As mentioned prior, it is essential for us to address the social and legal conditions that negatively affect the health of the children, which are the core issues. The following conditions all fall under the category of conditions that negatively affect children's health. The lack of basic needs. This could be the lack of food, safety, access to health care, education, and a major one, the lack of income. Low-income families not knowing how to petition for aid like Section 8 housing or food stamps. Lack of adequate, stable, and affordable housing. Houses would have plumbing issues or electrical issues that the landlord would not want to fix. Housing would be too pricey, and residents would get evicted for various reasons. Lack of clinics in low-income communities. And a final condition, the people not being aware of the aid that is offered for those in low-income communities. Step 4. Possible alternatives. Using the social ecological model and attacking the main issues at a community level, these approaches were formed. Approach number 1. Building clinics in low-income communities and employing both public health lawyers and healthcare providers so that patients can receive healthcare services and legal services at one place, facilitating the process of them getting the aid they need. And hopefully, as more patients go to the clinic, the word will spread throughout the community about it, and more people will go to receive the services offered. Approach number 2. Developing a program that educates low-income communities about the different types of aid available to those who need it. The aid could consist of financial aid, housing, food, etc. Step 5. A couple of recommendations. One recommendation to keep the clinic visits consistent amongst patients. It would be good idea for the healthcare provider or public health lawyer to schedule follow-up appointments with their patients to check up on their health and legal status regularly. And with this, it would be a good idea to set up a reminder system that reminds patients about their appointment through phone call or through email. Another recommendation to raise awareness of the services offered for low-income communities is to develop a program that goes door-to-door to families in low-income communities to inform them about housing aid programs, food stamp programs, services offered by the community clinic, and other things as well. Now, step 6. The action plan. I propose to build a clinic in the low-income community, keep track of the number of patients that come in within that month, and for the sake of an example, we'll say the month is of June 2018, and raise awareness about the clinic through public ads, going door-to-door, and other advertisement forms. We set a goal to have at least served 200 patients, assisting them with their health or legal status. And finally, keeping track of returning patients and new incoming patients for the next month, which would be July of 2018, and having a goal to have assisted at least 100 returning patients and 100 new patients to measure the effectiveness of the clinic. And now the 7th and final step, my opinion. Based off my experiences, it is important to educate those in low-income communities. The majority of low-income communities I've encountered usually consist of Spanish-speaking only, and they don't speak English. And there are rarely any bilingual healthcare providers or public health lawyers. Going into my second point, language is a big barrier when it comes to educating communities. And since the majority don't speak English, in my opinion, it would be a great idea to set up programs that are bilingual and hiring bilingual public health lawyers and healthcare providers when it comes to finding employees for these community settings. The final point regarding my opinion is that it is important, it is vital to establish trust amongst the community. Many people have the misconception that doctors and lawyers want to simply scam people out of their money and they are not helping out the community. The stigma must be broken, and I believe that this stigma will be broken through the direct work that we will do amongst the community. This concludes my presentation. My name is Seth Morales, and thank you for your time.